ladies and gentlemen. We're expecting quite a rather high number that we see, and I'm hoping that the rest will join us. But we are here today because of that seed that was sown. The seed about primary health care. So as soon as they gave me the call, I came up with an idea, and I said, how do we ensure that primary health care is what it's supposed to be? Because you see, right from Alma Ata Declaration in 1978 on the ideals of primary health care, with the 8 elements of primary health care which sought to look at equity, social justice, and access to health care. We've gone through a lot of repackaging. Okay, there's been a lot of repackaging of primary health care. I still remember the Abuja Declaration. There were some meetings, the AU met, we repackaged at the turn of the millennium. We went to Millennium Development Goals, and then now we are Sustainable Development Goals. It's just a repackaging of the same concept of the ideals of Alma Ata Declaration in 1978. What are we looking for? This group is of the opinion that the primary health care, as we said, would not be achieved if we do not focus on the individual who is supposed to be sent to Agroizu, Afram Place, some village in Tumu or wherever. And so our focus is on the individual. And we submitted the grant, and by the grace of God, we were blessed. Not many grants. Actually, just last week or so, and I don't want to remind Dr. Nadia Tego of the pain we went through. I was traveling to Cape Town, and then she wasn't hearing from me. I saw her missed call. She was calling because we had a deadline to beat. And then we were submitting a grant, Welcome Trust Grant. We had done all the people with the hard work. She is a focal person, was coordinating all of this with our friends in the UK. And then, of course, when I arrived in Cape Town, I had 24 hours, so I didn't sleep. Sat throughout the night with her, we were doing all this work. And we submitted the grant only after 48 hours to be told that we were ineligible. I mean, that's almost 4 million pounds and so many weeks of hard work gone. So, but this one, we were lucky. And by the grace of God, we've been blessed with funding to look at primary health care concept of improving universal health care coverage. Universal health care coverage. So, when we put, this will be the outline of my presentation. I'll give you a little bit of an overview and the objectives of the Health Collaborative. I'll show you some of the partnerships that we have, and then of course I'll talk to you about the pillars of the collaborative, and there will be details of the presentation by the lead pillars who will be working very closely with us for the next 10 years. And this is why we believe that it's important to engage you, because you are the people who will make the thing work. And then of course we shall share with you the next steps after this meeting, after we've engaged you, some of the actions, the key actions we've taken, and what will be following after this presentation. So the key concept is that the health sector is critical to Ghana's success. So I want to just share with you just a few overview. I still recall that those days when the Ministry of Health, they would say that if the Ministry of Health coughs, there are records for the rest of the ministries, departments, and agencies, because they are supposed to be epitomizing, if you like, planning, organization, and everything that obviously makes the ministries, departments, and agencies tick. And so the health sector's success is critical to governance achieving the Sustainable Development Goals. It's clear. Of course, it's a multi-stakeholder, and that is why we need everybody to be on board. And what we're going to be telling you today, we cannot do it all by ourselves. this management, following on the heels of successive management of this university, believe that we need to engage service and industry. So academia, service and industry collaboration must be deepened. And hence the reason why we brought you here this morning, because you can't sit in KNUST and expect a successful story to be told when the people who make the decisions as far as healthcare is concerned are not involved. So we brought you here first to share the ideas with you, share the ideas of the collaborative, and tell you that together we want to improve universal healthcare coverage through the ideals of the primary healthcare, which obviously are enshrined in the Sustainable Development Goals. And so the sector continues to be confronted with human capital challenges. I mean, today, apart from the basic degree, which many have to pay, if you were to earn a master's degree, you also have to make sure that you pay. How many people can't pay? Number one, acquire the competencies, the skills, the knowledge, and hopefully the right attitude to be able to deliver healthcare. And if we were to assume that they were available, the problem is that many of the healthcare workers would like to stay in Accra, Kumasi, Tema, and maybe Takoradi. Now, what happens to the hard-to-reach areas? What happens to that? And we believe that we can address this through this healthcare collaborative. And I'll be telling you how we intend to do this. So the focus is on the human being. We can't go always expecting that, the healthcare workers at work and doing what they're supposed to be doing, and in fact, they don't have the requisite skills, they don't have the requisite knowledge, the competencies, and of course, the right attitude to be able to deliver healthcare. We believe that we must give them the right skills, sharpen obviously their competencies, and ensure that they give the required service to the people, which we say must be quality healthcare service. But the human capital is key. It's very, very key. And in spite of the achievements we've made and the gains we've made in the past, we still have a shortfall in terms of numbers per capita. If you were to look at the doctor-patient ratio or doctor-client ratio or nurse-client ratio, we're still disproportionately not anywhere close to where WHO standards are supposed to be. So the focus of this collaborative will be the human capital of the healthcare sector. The other thing which I want to talk to you about is that these human capital constraints remain one of the pivotal challenges that threatens Sustainable Development Goal 3, the health and well-being of our people. And so, if you don't have the requisite human capital, how do you address the well-being of your people? Of course, we're not just by saying that there's only one side to the equation of the COPE strategy. Obviously, there are two sides. The client orientation and provider efficiency is what we're looking at. And so it's both sides of the equation. But whatever it is, it must be centered on the human capital. Which is why I propose to you what I believe is social justice, what I believe is equitable, what I believe is going to afford universality as far as the coverage of healthcare is concerned. This country has tried. As I say, there's been several metamorphoses of the concept of primary healthcare. Okay, through the CHIPS compound, which is our basic unit of delivering healthcare, all through to the various levels of delivery. But there still remain gaps, and I think it's important that we address these gaps. So the objectives of these collaborative, first, we want to build and strengthen capacity of healthcare students. So we'll be looking at nurses, doctors, paramedics, biomedical scientists, various quasi-healthcare individuals and organizations, which is why we have all of you here represented. And we carefully selected you as our first stakeholder. There are going to be a series of stakeholder engagements. And we thought that with you and listening to you and sharing this vision with you and of course you making inputs, we will be able to shape and sharpen this over the next 10-year period that we do have this healthcare collaborative. The focus, obviously, as I've indicated earlier, is on primary healthcare, to ensure that we bring healthcare to the doorstep of the ordinary Ghanaian. And it's become expensive, as we all know, even with the National Health Insurance Scheme in place. The second point will be to enable our students to apply the needed skills. We'll be working with 8 other institutions in Africa, and then we have a northern partner in the University of Toronto in Canada, and I'll be showing you those 8 partners in Africa that we'll be working with. The idea is to offer a multidisciplinary training to our students. And so, you see, the point is that those of us in health, we seem to feel that we're insulated. And of course, it can be quite monotonous and because you're doing the same things over and over again. But if you stop doing those things, then of course, the clients also suffer. But the point is that, is there or are there avenues and opportunities to break camp from this insulated area of risk aversion to other areas where we offer additional skills to our students? That's exactly what we seek to do. So we want to enhance the competencies in a cross-disciplinary activity. So for example, if we're working with one of the collaborators we had, Andre, the University of Nairobi and others, we want to send some students there, for example, to sharpen their competencies in some of those areas that we believe, for example, Kenyans may not have. And even if we do, it's important to have that cross-regional and sub-regional experiences that will help them to be able to grow the health sector and be able to transform the health sector. We also seek to optimize the entrepreneurial abilities of the average healthcare worker. Because we are quite, healthcare people can be quite boring, seeing the same patients, seeing the same things, doing the same things, so on and so forth. But are there avenues for health entrepreneurships? This morning you'll be hearing some ideas as far as health entrepreneurships and ecosystems creation are concerned. And we'll be launching, for example, startups. How does a nurse who doesn't want to see herself, lifting bedpans and all these things all the time, practice nursing in an entrepreneurial way? How can we do that? And we seem to think that we have ideas about these things. We want to break the traditional thinking of health and help healthcare working students to be able to start thinking beyond the traditional model of healthcare delivery. And that's one of the things that we seek to do in this collaboration. And we also seek to develop a dynamic, sustainable, and of course, long-term network of leading Africans. So what we're seeking to do is that when these students graduate and they have these skills and competencies from across a wide range of disciplines, once they graduate and they are telling their stories and we know where they are and so on and so forth, we're going to be creating a network of these healthcare workers. It doesn't matter which field they are in. If you find yourself, for example, in academia, like we do find ourselves, you still have these ecosystems of networks that are being created across universities, alumni, and so on and so forth. And all of these will have, spillovers that will create dignified and fulfilling jobs for our people in those various sectors that we're talking about. This is what we seek to do by way of this health collaborative in the next 10 years. And we have opportunities to be plugging and playing along. There will be great ideas. We'll be listening to you. So for example, if the Ministry of Health came to us and said, Prof, can we run this program, which perhaps we don't have, but there's deficiency in terms of skills and so on and so forth, we will listen. And then together with the Tertiary Education Commission, we'll see how we can fashion out. And you know that Kwame University of Science and Technology, already there's one program that doesn't exist in this country certainly, and in many African countries that we're already thinking about starting. We've had talks already with the Tertiary Education Commission and the Kwame University of Science and Technology. For those of you who did not attend this university, we are trailblazers and we believe in excellence. And very soon, you'll hear about the health entrepreneurship program, which we will be mounting. We have a team of serious experts. As was mentioned to you, Professor Ellis is spent at least 10 years at the highest level of educating institutions of higher learning. Professor Owusu-Dabo, for a very long time, for over 30 years, has been faculty and has been, dean of students in so many ways. We will be working with students, and therefore the experience and expertise in terms of managing students is there. And then, of course, we have some lovely ladies who have joined us. Princess is already on board in this picture. And we have our Vice Chancellor, Professor Mrs. Rita Kusia in this picture. I have some very nice gentlemen who are already married and therefore are not available, but they will all be here to make presentations and you get to know them better. There are 3 pillars to this collaborative. These are the partners. We have the African Leadership University, we have AMREF, we have AIMS, we have Ashesi University, they're collaborating with us. We have the Mastercard Foundation as the founder of this whole collaborative, and of course, the Kwame Nkrumah University of Science and Technology is principal. It's the reason why we've called for this. University of Toronto will be our northern partner in this collaborative, and therefore there will be opportunities for students to travel across these universities within the sub-region in Africa, and also some will have opportunities to travel to Toronto and be back to serve the country, our motherland. I've said to the pillar leads that when the students are going to places like Toronto, they should be made to sign an undertaking that when they go, they will come back. It's important. Some of us, we came back. When you see these good people, they came back. The offers were there. When I finished PhD, I had a 5-digit salary. I refused. In pounds, I refused and came back to this country. So it's important that when they go, I've told them, well, they've already started the recruitment process and all of these. Students will get scholarships and so on and so forth. When you go, and we are counting on you, so when you release them to come to us, our promise to you is that we let them sign, and wherever they are, we will push them to come back. I mean, it's important that when you gain the experience, you come back and stay. Otherwise, we won't achieve universal healthcare coverage. Who should go to Aborigine? And we'll be selecting people from deprived areas, giving them scholarships and offering them opportunities to study. You get a scholarship, you get opportunities to go to Toronto, and then you go and stay there. Who should go back to your village and transform your village? So that's the whole idea. And the plan is that we'll offer these students those opportunities to be able to ensure. It's a growing team. So we had a visit from the friends from the University of Toronto visiting with us, Gwendoz, Penina, and others who visited us. You can see in that picture, my Dean of Quality Assurance particularly is there. I have the finance team also, in addition to the rest of the team you saw earlier in the previous picture. Of course, Dr. Nadia Tego is standing right behind Dr. Princess Achampo. So we have a growing team, and I can tell you that by the close of today, you'll see another, some have been hired, and there will be greater numbers to represent to you as we go along. It's for a period of 10 years, and as I said to you, by the time we finish the 10 years, you can imagine the number of students that we would have had in terms of the various programs that we're running, and those whom you would have released to come and join us to support this whole healthcare collaborative.